Szanowni Państwo, dzień dobry. Miło mi jest się spotkać z Wami po raz kolejny. W tej edycji będziemy mówić o plazmie, a mianowicie o Plexrze Plus. Prelekcję przeprowadzi dr Marisa Heinz, która jest lekarzem medycyny estetycznej. Tytuł doktora uzyskała na Uniwersytecie w Kapsztadzie i jako jedyna z niewielu lekarek w RPA może pochwalić się europejskim tytułem magistra medycyny estetycznej i terapii. Posiada bogatą wiedzę na temat regeneracyjnych zabiegów. Jest lekarzem, który bierze udział w wielu badaniach na temat regeneracji skóry. Zakres jej praktyk obejmuje minimalne inwazyjne zabiegi takie jak botulina, takie jak wypełniacze, laser CO2, ale przede wszystkim specjalizuje się w plazmie i posiada głęboką wiedzę i doświadczenie, dlatego zaprosiliśmy panią doktor do prelekcji. Zanim przejdziemy do wykładu pani doktor, gwoli wstępu powiemy sobie troszeczkę o plazmie. Technologia mikrowiązki plazmy nie jest niczym generalnie nowym. Pierwsze zastosowanie w chirurgii małoinwazyjnej zostało opracowane na Uniwersytecie w Rzymie, a następnie technologia ta została odkupiona przez włoską firmę GMV, która przez lata unowocześniła urządzenie, technologię oraz zarejestrowała ją m.in. w Stanach Zjednoczonych, uzyskując certyfikację FDA w Chinach, w Japonii, w Australii i w Europie, gdzie urządzenie posiada certyfikat medyczny. Cały czas trwa nieustanny rozwój tych technologii. Możemy ją zastosować w nieoperacyjnej blefaroplastyce, w leczeniu zmarszczek wynikających z wiotkości skóry. Plex ma również zastosowanie w leczeniu aktywnego trądziku, w usuwaniu łagodnych zmian skórnych, w rogowaceniu łojotokowym, w elastozach, w usuwaniu małych naczyniaków, w usuwaniu kępek żółtych. Oczywiście redukujemy poprzez plazmę blizny, usuwamy tak zwane zmarszczki palacza, różne kurzajki, brodawki łojotokowe, cysty. Także zastosowanie Plexra jest dość duże. Nie zapominajmy o tym również, że Plex to nie tylko dermatologia, to również okulistyka, gdzie usuwa się włókniaki okołogałkowe, duże zmiany skórne okołogałkowe, a jednocześnie głowicą białą pracuje się już na gałce ocznej. To również ginekologia, gdzie Plexera używa się do rewitalizacji odmładzania pochwy, do usunięcia lekkiego przerostu warg sromowych mniejszych. Plex to również stomatologia, gdzie wykorzystuje się go w leczeniu uśmiechu dziąsłowego, wybielaniu dziąsem, usuwaniu zmian w jamie ustnej i odsłonięciu na przykład implantu. Plex staje się coraz bardziej popularny w medycynie regeneracyjnej, gdzie wykorzystujemy go do tak zwanego bezinwazyjnego liftingu. Pobudza nam fibroblasty do produkcji elastyny i kolagenu oraz porządkuje i układa włókna kolagenowe. Nowa technologia wykorzystywana w Plexerze to technologia peelingu, gdzie uzyskujemy rewelacyjne efekty Na ten temat zresztą powie pani doktor w swojej prelekcji. Jest to tak zwany Plexr Shower. Ale powiedzmy sobie jeszcze, dlaczego tak działa plazma. Plazma jest zjonizowanym gazem zawierającym w przybliżeniu takie same ilości ładunków dodatnich i ujemnych. Ze względu na te swoje specyficzne właściwości nazywana jest czwartym obok gazy, cieczy i ciała stałego stanem skupienia. Plexr jest generatorem plazmy, który wytwarza kontrolowaną i celowaną mikrowiązkę dzięki jonizacji gazów zawartych w powietrzu. Nie zapominajmy, że Plexr jest jedynym urządzeniem, gdzie nie potrzebujemy dotykać skóry. Plazma tworzy się między końcówką urządzenia i skórą pacjenta dzięki niewielkiemu łukowi elektrycznemu, który w kontrolowany sposób zdolny jest do sublimacji naskórka i obkurczania skóry w miejscu jego działania, a co za tym idzie, uniesieniem tkanek. Podczas działania na skórę następuje kontrolowane uszkodzenie jej powierzchni. Dzieje się to do granicy warstwy podstawnej naskórka, co stymuluje jej procesy naprawcze. I teraz w odpowiedzi na to uszkodzenie fibroblasty zwiększają produkcję prokolagenu typu 1 i typu 3 oraz produkcję transformującego czynnika wzrostu beta-1. W badaniach klinicznych nie zaobserwowano żadnych uszkodzeń w obszarze skóry właściwej. Nie zaobserwowano, co jest ważne, również zmian martwiczych podczas procesu gojenia i jedynie ogniska stanu zapalnego w leczonym obszarze. U pacjentów gojenie jest szybkie, obrzęk ustępuje po 3-4 dniach, rumień ustępuje w ciągu 20 do 30 dni, a skutki niekorzystnego działania są stosunkowo nieliczne i krótkotrwałe, a stosując się do zaleceń lekarza, można te skutki zredukować do minimum. Dlaczego warto wybrać Plexera? Przede wszystkim to ponad 2 miliony zabiegów w 55 krajach na całym świecie. To badania kliniczne, które potwierdzają mechanizm działania, skuteczność i bezpieczeństwo. To ponad 20 prawie lat obserwacji na rynku medycyny estetycznej, patenty, i kilkadziesiąt publikacji w PubMedzie. Weźcie sobie Państwo do PubMedu i możecie naprawdę znaleźć świetne publikacje z całego świata na temat tego urządzenia. Dziękując za uwagę, zapraszam teraz na wykład pani doktor.
When we hear about Plexr, the name of Plexr has been around for many, many years. It is, we know that there are a lot of other devices that unfortunately ride on the back of the Plexr name, but there's only one true plasma device, and that is Plexr. So let's talk about the technology. We understand plasma as the fourth state of matter. If you're taking atmospheric gas and you apply an electromagnetic field to it, you're going to excite the gas. That's going to become electrically charged, and you're going to be able to discharge energy onto a field. Plexr technology is using that understanding, putting it into a generator that provides you as the operator with absolute control on the energy that you're going to apply on the skin, the accuracy of the beam, which is going to give you the same reproducible energy on the skin, and that gives you the precision and the result without hazardous risk. As I said, the ionization of air molecules generates a discharge of energy, which we call a microplasma beam. It's an amber light, as opposed to the other energies that we see with radio frequency, would generally be a white or a blue light. When applied to the skin surface, you have two clinical effects: superficial localized sublimation or erosion of the epidermis, but sparing the basal membrane. That's very important in darker phototypes specifically, because if you break the basement membrane, you're potentially going to create a necrotic zone in the dermis, which leads to more inflammation. The second is a deeper biostimulation of the dermis, and this is just through heat generation into the papillary dermis. That's going to give you collagen contraction, and as we know, over time, regeneration of the tissue. And with what Professor Soteris Thiomas has shown us, with the evidence of collagen type 3 production, which is what we want in the papillary dermis to maintain that elastic plumpness within the skin and not scar tissue. We've proven this scientifically when we compared Plexr with other devices, mainly radio frequency, and what we see is that the energy discharge through the skin does not leave a thermic zone. So there's no, a necrotic zone. So there's no damage within the dermis, but just only a heat biostimulation. As you see, with immediately post-treatment histology, you are sparing the basement membrane. You can see here a pre-treatment epidermal tissue with your basement membrane and your rete ridges and your loose connective tissue, papillary dermis, reticular dermis, and immediately after a treatment, the only erosion or necrotic areas within the epidermis, the basement membrane is spared. You can see the contraction of the connective tissue in the papillary dermis as well as in the reticular dermis. What this means from a restoration point or from a healing perspective is that your only healing time is going to happen within the epidermis, and you're going to biostimulate over time. So rapid healing times compared to other energy-based devices. With the expertise of Dr. Elena Rossi, she's a very well-known dermatologist from not Milan, but Modena. From Modena, the balsamic vinegar place, with confocal laser microscopy, have shown that over time, this biostimulation process leads to the improvement in connective tissue. So the compaction of the collagen fibers over time. So before the treatment, you can see loose connective tissue, irregularly spaced, and this is after 3 months, the compacting of the connective tissue. So reorganization, meaning that you're going to have firmer tissue, which is evidenced in the results that you get. And here another on the eyelid skin, again, irregularly spaced, disorganized connective tissue that we see with solar elastosis or photoaging. With the Plexr, with that biostimulating process, more compact, more organized connective tissue, so a healthier dermis that's going to give you a smoother appearance. I'm not going to go much through the technology. I think you've seen that through the video, but essentially you've got a device with a microprocessor that constantly calibrates the handpieces to ensure that every time you activate the device, it's going to give you reproducible results. So you're not going to get half an energy output and then a maximized energy output every time you activate it. So just to show us that it's a very precise microbeam that's very well controlled and to ensure safe and good results. And obviously, with that, the peace of mind that you are using a device that has actually been accredited and followed up by a lot of research to show that it actually does work and works across the world in all patient and doctors' hands. So let's talk about the versatility. As I said, for you who are dermatologists, doctors, plastic surgeons, dentists, even gynecologists, we have the indications that can actually be treated by the Plexr. Why do we have 3 handpieces? Well, you have different energy outputs to allow you to safely work with a specific thickness of skin. So delicate skin around the eye or even the conjunctiva, you would use your white Plexr. A green Plexr is more kind of your workhorse for medium thickness skins or lesions, and then your red Plexr for dentistry and for thicker skin and thicker lesions. The indications I'll go through with you as I show you some befores and afters, but essentially remembering that your less intensity devices for your delicate skin tissues, if you want to treat small lesions that are soft, or if you want to do skin rejuvenation, vaginal rejuvenation, anything where there's skin you can basically treat. Your green handpiece for more intense tissues or medium density tissues, wrinkles in the face, dyschromias or solar lentigos, xanthelasmas, which we'll talk about, small scars, fibroids, and then your high intensity for your more intense tissues and intense energy requirements. I'm not here to talk about other devices, but I think it's a very important conversation to have with your patient. Patients nowadays come to a doctor to say to them, I want this treatment, not the other way around, where doctors say, this is the best treatment for you. And unfortunately, social media creates a lot of confusion in the understanding of patients. So it is our role as doctors to explain the technology, why it is the best for the indication that you've chosen, and to explain that there are, unfortunately, devices on the markets that are not truly plasma devices. With Plexr, we can promise you that it will create a precise and stable physical phenomenon due to the technology and the expertise. It will not damage the dermis when applied correctly. There's no risk of electric shock or tissue necrosis, and that you're going to have a desired result with minimal downtime. Just to show the different beams that we get with other devices, you can see this device is potentially a radio frequency device, not plasma, although it creates electric discharge. Just to say that electric discharge is a very important thing, because the higher the amplitude of the electric discharge means the higher the thermic injury, where Plexr only activates at a specific distance. And then the force of the energy, you can see it's not very precise. It's quite broad, scattered, and therefore a higher risk for thermic damage. With laser, Plexr is not laser. We understand laser as light amplification by stimulated emission of radiation. So it's using a completely different energy field. The thing with me, I work with lasers in my practice. I cannot use it in darker phototypes. There's a risk for hyperpigmentation. You do rely on thermic damage with laser in order to get you the result, different to plasma. There's definitely longer downtime, less versatility within the laser type that you've got, and as we know, quite expensive. And as you see with a laser treatment, I'm going to go down here so we don't have to hear it. If you're using CO2 laser, where we generally kind of play in the same field with plasma energy, by using CO2, you don't really see what you're achieving. Yes, you see a little bit of tissue contraction, but you don't really see that wrinkle disappear. You also have to treat a much larger skin surface area in order to get the contraction. So more downtime, and you don't really see what you're going to get. With Plexr, every time you apply your spot technique, you're going to see the contraction of tissue right in front of your eyes, and you know to a degree what the patient result is going to be. Metric surgical units, I don't have any experience with radioscalpels, but we know in surgery with, nowadays, if you are doing a surgical blepharoplasty, a lot of people are using radioscalpels. Again, you understand that it's a completely different technology that has a much higher power and frequency in order to operate. And so, again, different clinical outcomes that you get. So, how do we apply the device? We basically have two techniques that we use in order to perform a treatment, and that's based on the clinical indication. You either want to contract tissue, and we use the spot technique. So you have single spots of plasma. We call it in a zigzag fashion to get contraction of the tissue. Or if you want to remove tissue, so you basically slicing off the lesion with the plasma energy, we use the spray technique. So two techniques to do completely two different treatments. In practice, tissue contraction with spot technique, you can see how the tissue contracts in front of you. Very important that when you space your Plexr spots, that you allow natural, healthy tissue around it so that when it heals fast. If you were to spray the entire eyelid, it will take much longer to heal, and that obviously runs into more inflammation. So the spot technique, we focus on leaving tiny distances between the erosions to allow epidermal contraction in a shorter period of time. When we want to remove tissue, we spray, as you can almost imagine, spray paint of plasma on the lesion, and you're basically eradicating the lesion. Great for soft tissue lesions, but be conscious of the fact that if you remove skin, you are going to not have normal skin underneath it. There's no alternative. You can use a scalpel and slice it off. You can cut it out. You're going to have a scar. You're going to have a defect within the skin. The aim with using Plexr to remove lesions is to improve the visual appearance of the lesions. But understand that once you've removed skin, the new skin that forms is not natural, original skin. As we know, the procedure goes very quickly. We don't require a local injection. We use topical injection, topical anesthetic, so a local anesthetic cream. There's no stitches, there's no blood, and you get immediate and long-lasting results as long as it takes for the lesion or the skin defect to form again. Minimum downtime, I think this is a key to patient satisfaction and patient experience. Yes, you form crusts, redness that disappears over time, but much faster than the lichened energy devices that we have as a comparison. So let's talk about periocular rejuvenation. I think we are all doctors, we are not technicians, so we see patients, we don't just see problems. So when you assess your patient, ask yourself what makes this eye look tired? And understand that it's a holistic approach that we need to be mindful of. Yes, there are bony changes around the eye. The orbital fossa enlarges with time, and the soft tissue kind of implodes into that fossa. So the eye becomes smaller. You have sagging and drooping of soft tissue. And remember that may consist of fat, ligaments, and muscle. And then obviously the skin laxity and the elastosis that takes place. Welcome. If you appreciate the science of Plexr, you understand that your only place here is dealing with the skin laxity and the elastosis. So it's important to evaluate your patient before you're going to do a treatment. Look at the type and the degree of deformity. Look at the skin quality, the skin age, and the skin phototype if you are dealing with greater phototypes or higher phototypes in your practice. The type and the degree of the deformity, There are different reasons for droopy and tired looking eyelids. You can have too much skin, you can have too much fat, you can have laxity of the skin to the point that the brow starts to drop, and you can even have litosis. Understand that you are not going to be able to get an amazing result if there's too much fat, a brow drop, or a litosis. So assessing your patient, explaining to them their deformity and what your device and treatment is going to offer them is going to give them the patient satisfaction at the end. Skin quality, as we sit here, mainly men, you've got a very good skin quality. You've got lots of collagen, you've got a thicker epidermis. So doing a moderate to intense treatment will give you a very good result within one treatment. Ladies, thinner skin, more prone to puffiness, and potentially need to be a little bit more delicate with the way that you treat the skin. Also, if you have a skin that's easily inflamed, so patients with allergies who are antihistamines, they tend to be puffers, and the skin stays red for a long time. And then the big quality problem is an uncompromised skin. So again, we are treating skin, we're not just cutting it out. Dry, dehydrated, and a compromised skin barrier is something you've got to be very careful of, because it says to you that this skin is inflamed already before you are going to inflame it more. So the post-procedure time might be a little bit longer, and ideally you want to optimize that skin before you treat it. Skin age, again, treating the skin, we understand that a young skin responds much faster than an older skin. When we're in our late 20s, it takes about 28 days for epidermal regeneration without any other stresses. By the time we're 50, that epidermal regeneration can be up to 90 days. So younger patients respond better compared to older patients. And in my country, obviously, the beauty of Plexr is that I can treat confidently darker skin types, but there is a risk for pigmentation that we know is transient. So for me, the ideal non-surgical blepharoplasty or soft surgery candidate is someone with excess skin only. They don't have excessive fat pads that I can't treat. They have minimal to no brow ptosis, and always be aware of eye litosis. So in my case, this is right in the beginning when I was very enthusiastic about doing Plexrs on every patient that I found. Quickly realized that I don't get the best results if someone has excess orbital fat or a droopy brow. Poor skin quality. This was a patient who was a pilot, a lot of toxins in her system due to all the emissions, aviation emissions. She sat with a lot of lymphedema. She had a botched surgical blepharoplasty, as you can see. They didn't get the desired results on the right eye. So I just treated the right eye to give her a more symmetrical look. But she ended up sitting with puffiness in that area. And I think that's very important to explain to a patient beforehand. That problem was there before, but it's a little bit more apparent now, and you can't treat that with Plexr. And then eye litosis, for those of you, the ophthalmologists that are here, definitely not my domain of fixing, but you understand that you can't retract skin and lift the actual eyelid. So when you see eye litosis, explain it to the patient and explain the limitation of the Plexr, and that patient probably will need a eyelid ptosis correction in order to make them look less tired. Pre-treatment procedures. So here we want to make sure that we can do everything in our ability to optimize the skin barrier. And this requires home care. So how many of your patients are actually on a home care regimen? They cleanse their skins, they use moisturizer, they use sunscreen. No. They come to you because you're going to fix them in 30 minutes, and then they think that that's it. We have to educate patients that the skin is an organ. It needs nutrition, it needs protection. It's the only organ that we need to protect from UV radiation. We don't have to protect our hearts from UV radiation or our livers, thank goodness. But our skin, the largest organ, gets attacked from inside and outside. So we have to educate our patients to look after their skins. And if they can only use a sunscreen, that at least is a good thing. If your barrier is compromised, you're not going to get the best results. I prepare my skin, patient's skin, if they're not on a formal routine and I'm worried about pigmentation. I like to use modified Lichtmans. Do you get modified Lichtmans in Italy? Modified Lichtmans, hydroquinone? Hydroquinone, yeah. So if you are going to apply it around the eye or delicate tissues, 2% hydroquinone, 0 retinol, because the retinol can irritate the eyelid skin. If you're treating a whole face, then you can go up to a 5% hydroquinone with the retinol and obviously the hydrocortisone. Remember, the hydrocortisone helps to not make the hydroquinone too toxic to the melanocytes. Best case scenario is to get your patient to use home care to moisturize the skin and use sunscreen. You would stop the treatment 5 days before the treatment to prevent exaggerated inflammation. How many procedures do you require to get a result? It depends on the deformity, it depends on the indication. Some patients need 1, some patients need 3 sessions, and some patients need 4 to 5 sessions. But that is up to your discretion and the patient's satisfaction. Complete skin regeneration is much shorter when you only damage the epidermis, so it takes about 3 to 5 days for the epidermis to actually heal. But the long-term healing can sometimes take up to 20 days, and obviously the skin needs time to then strengthen, and that might take sometimes up to 3 months. So generally what I do is I assess the skin after the treatment to see how well it's recovered, and then I make a decision as to how quickly I will do a second session. In some cases, you can do it quite quickly after about 4 to 6 weeks in a young patient, but in an older patient, sometimes I wait up to 3 months to ensure that the skin is fully healed. The issue is that you get a cumulative inflammation if you are spacing your treatments too closely together. So just a quick video on the non-surgical blepharoplasty and the technique that we advise. So when you treat, you want to treat the excess tissue. So you don't treat the entire eyelid like you would do with CO2 laser, for example. You would just focus on the excess tissue. And as I said, it's that spot technique, relatively closely spaced spots of plasma, and you will see the retraction in front of your eyes. Start low and work your way up. So you're basically lifting the tissue up. Interestingly, when you look at an eyelid, what makes an eyelid look young is the space between the actual eyelid line and the skin. If the skin is slanted, the eye looks tired. So sometimes you don't have to treat the entire eyelid. You can just treat the deformity where the eyelid starts to sag or the excess tissue starts to sag. When I do the practical demonstration, I will take you through this process again. After you've done your, I'm going to speed this up just for time. After you've done your treatment, we then also, I want to get there now. We also then look at the diagonal laxity. By squeezing the brow, you're able to create little kind of curtains of excess tissue, and that will allow you to almost open the outer aspect of the eye, which is what, especially in women, we want to achieve that little kind of lift and tightening around the brow. The healing process, initially we have little scabs that form. Scabs take about 24 hours to form, so you want to leave that wound that you've created clean. I generally advise my patients to leave the area alone. Now you're residing on wound healing. You want to facilitate wound healing by protecting the tissue, not by adding chemicals and makeup and all sorts of nonsense. And you can see how the scabs form after day 1, 2. They start falling off depending on the type of patient that you're treating. And by day 5, 6, and 7, it improves. This is a perfect patient, obviously. Sometimes you do see that scabs fall off a little bit later. So every patient experience is different. Post-care. So once you've created a wound, now you're a doctor again. We have to respect the wound healing process. This is dry wound healing as opposed to wet wound healing. When we do laser, we reside on wet wound healing. We keep an occlusive barrier. But dry wound healing, we leave the scab to form. And with the healing, that scab contracts the epidermal tissue to close it up. Leave the scabs on until they fall off by themselves. Do not aggravate it. You'll make the wound healing longer and create more inflammation. You can gently cleanse the area. Don't be excessive. Protect with skin area. And I think the big fear always is that you will get it infected. Now, the wonder of Plexr is that plasma energy is actually bactericidal, it's antiviral, it's antifungal. So you're actually sterilizing the area as you treat it. In my experience, which is 10 years, treating hundreds of patients, I've never had a patient with an infection. So testament to the energy and the effect of the treatment on the skin. The suggested post-treatment protocol, we offer you a product called LGM, which is the sister company to GMV, I would say, and they provide you with a cleansing pad to keep the area nice and clean, a skin cover, which is a tinted SPF, made out of minerals and homeopathic ingredients. So actually to protect the skin in its healing phase without irritating it. So it's not the same as a foundation, which is ridden with many, many chemicals that are toxic to healing skin. And then the Factor K cream, which is an amino acid complex with vitamin K and vitamin E to facilitate the healing process after the treatment. And a little bit of an instruction manual that you can use. Big remembering, gentle cleansing, protect the scabs from, don't scratch it off. Apply your Factor K cream after the scabs have fallen off. And if you want to protect the skin, then the skin cover works quite well. You buy the kit. It has everything inside it with the instruction manual for the patient because patients forget and they can read it every day to remind themselves. Very important after you've removed skin, common sense to us as doctors, but not to a patient, is that if you've got new skin, it needs protection. And you also want to teach patients to actually protect their skin in the future. Otherwise, they'll be in your office every week. So ongoing sun protection. In South Africa, we're very, very mindful of the sun. Our UV radiations are much higher than it is in Italy. And for much longer. So at least we're getting through to patients that sunscreen is important. So some results. My favorite patient profile is a young patient. I know that they're going to get good results even after one treatment. You can see how she almost has a double eyelid. And this is 2 weeks after. So a very happy patient, very short downtime period. This is an older patient of mine, but a very well optimized skin barrier. So she uses retinols, sunscreen. You can see that skin is able to respond beautifully, and that's after one treatment. These patients we get very excited about because we know they will get very good results, and they'll be very, very happy patients. Again, these are results from all over the world to show that it works not only in Italy and South Africa, but also across the globe. You can see that this patient almost has a slight litosis. So important to explain to the patient that the eyelid is not going to lift up, but the skin will retract. Not just supraorbital skin, but also an infraorbital skin that you can tighten. This is what a treatment would look like before and immediately after. As we say, you can see the retraction immediately, and it improves over time. Lower eyelids. This is one of my patients, a darker phototype. You would say he's a phototype 5. And again, with adequate pre-treatment and post-treatment. He had no pigmentation. Very happy patient. Lower eyelids, again, to show and to assess a patient correctly, this patient has malar festoons and puffiness and excess skin. You're not going to be able to treat the festoon or the malar edema, but you're going to at least contract the skin. So always show the puffiness before you do the treatment and explain that your treatment is not going to improve that. They need proper lymphatic drainage and other techniques, which is quite difficult to achieve. Darker phototypes under eyes. One of my favorite treatments is removal of xanthelasmas. Again, in my experience, I don't think there's any better treatment than Plexr for xanthelasma removal, because you have two options. You can either use a very high TCA, which will have no endpoint. You can't control the endpoint, so it can go too deep, or it can't affect at all. Or you have to remove it surgically. And we understand that xanthelasmas return. Even if you've cut it out, it will come back. It's a genetic predisposition. So to be able to selectively burn the lesion off. So here we're using the spray technique. We are removing the epidermal skin. This is not spot, this is not skin retraction. And we're burning the fat out of that lesion until we see no more fat deposits. And that will take a while to heal, because it has to heal like a lesion from the bottom and from the side. Luckily, the area underneath the eye heals beautifully if you were to spray it. Yes?
Which handset are you using there? The 1 watt or 2 watt?
The 1, depending on the skin thickness, I would say if you're treating very fragile skin, if you're using the 0.7 watt, it's going to take you a long time. But if the skin looks like it wants to kind of tear before you treat it, I always start with my lower energy device and work up. I use a dermoscope to actually see if I still have fat, because sometimes in the specific types of skin you can't see the fatty deposits, and it becomes quite black. So you gently wipe, look for the deposit, and then burn selectively until it's out. But explain to the patient this will take time to heal. With the upper eyelid, you can use a green Plexr or the green handset, which is the 1 watt. If you've got very thick skin and you are very experienced, you can use the red. But always start low and move up with your own confidence. This is a patient of mine, a difficult patient. She had a very, very large xanthelasma that actually was treated with a very high TCA. And for some reason, she's scarred with the TCA in this kind of C figure. So the xanthelasma actually had more space to encroach. So she had quite a big deposit on the medial side, and it actually encroached onto the inferior medial side. We treated it very, very carefully, and a very good result. Some other results from around the world. So, follow up with your patient. Again, we are doctors, we're not technicians. This is a patient, we've got to follow up, and we've got to ensure that they're having the best patient experience after the treatment. Tell them that they are going to scab. Tell them that they are going to swell. They are going to be in minimal discomfort, redness. I always tell the worst, and then the patient is relieved when it's not so bad. Follow your patients up. I phone my patients for the first few days just to check in with them, WhatsApp. And then I see them at 2 weeks to ensure that the scabs are falling off and that the skin is healthy underneath. And then follow up again at 4 to 6 weeks to see if I can repeat the treatment if I have to, or if I need to wait. And take photos. That's probably the most important thing. Take photos before, after, and 3 months later. So, complications. Important to explain to patients that post-inflammatory hyperpigmentation is a phenomena of the patient. You can have 10 patients and 5 will have the risk for inflammation, and you wouldn't know it before you treated them. So again, and when you take a history, always ask, do you suffer from PIH, or do you get darkening of your scars after a wound? If they say yes, please treat them. So pre-treat them with the modified Klichmann's or the hydroquinone, or any tyrosinase inhibitor. It will also improve the quality of the skin, and it will lessen their inflammation afterwards. They may still develop PIH because it's inherent to their genetics, but you will be able to successfully manage that in the post-treatment. In my study that I did for my thesis, I focused on phototypes 3 to 6. I think it was 60% of my patients developed PIH, which is not what I wanted to hear, but it's what happens. None of those patients had permanent hyperpigmentation. It resolved after 3 to 6 months, which we see with any energy device. I had no patients with hypopigmentation. That is your biggest worry when it comes to energy-based devices around the eyes. Not so bad under the eyes, because that always looks better. But if you have a hypopigmented spot on the face where you've treated, your patient's not going to be happy, especially in darker phototypes. And as you can see, the resolution, so quite a dark PIH area that resolves beautifully over time. And an Indian skin type, so skin type 4, very, very prone to PIH that settles. Prolonged erythema, you probably see this more in your patient profile, more common in lighter phototypes 1 to 3, 1 to 2. Again, it's prolonged inflammation, and it's generally patient factors. It also resolves within 3 months. So I always tell my patients, if you are going to develop a complication or a prolonged inflammation, it generally resolves after 3 months. And that's when using your Factor K cream is going to help and facilitate that healing. Then something that I don't see a lot of, but a lot of my doctors that I train send these worrying photos. You can see there's a slight epidermal indentation where you've treated. I don't know if you can see it on the screen, but tiny little spots that generally when they put makeup on, they say it looks like a little golf ball. Now, this again is transient. It fully recovers within 3 months. My assessment is that it generally happens in patients who are prone to swelling and inflammation, or not a very well optimized skin. So patients who sit with dry, dehydrated skins, they take longer to heal, but this generally resolves spontaneously within 3 months. You can increase that process with microneedling. You can also skin boosters, hydration of the area that will help and speed it up. And then finally, again, no devices without complication. And when we compare it to other devices, energy-based devices, we understand that it has a clinical effect. It has also the risk for complications, but the complications are far less than compared to other devices, which is why it's the ideal treatment to consider. I think for me, as a practitioner, my fear is always that I'm going to create a permanent defect. And as I said, with 10 years of experience, I can happily say that I haven't had any of that. And I've treated many patients. Other applications, so active acne, again, Dr. Elena Rossi did a study a few years ago treating active lesions. Again, it's a mystery as to why plasma would do that, but again, it probably has a biostimulatory impact on the bacterial growth within the skin. This patient was just treated with Plexr, and after 6 months, still didn't have a recurrence of the acne. So it's like a little bit of magic, the plasma energy. When we treat active acne, we use a very small energy, so we'll use the 0.7, the white hand piece, and you use tiny little spots to work around the rim of the inflammation. So if you have a pustule or a macule, I find it works better with macules, but pustules, you're basically just creating a little erosion so it can extrude itself. See, it's not wanting to do what it wants to do. Let me help it. So you would basically identify your lesion, and you spot in the center of the lesion, like you would use a needle, and you can then extract the lesion. What I also do is with a lot of women with hormonal acne, especially in the neck area, they don't have the actual pustule, so it doesn't rupture. It just makes a macule that's quite problematic. And I find that, again, there's no other treatment that can do it. Just by tiny spots, so literally about 6 spots around on the rim, the margin of the inflammation, somehow reduces the inflammation long term, and they disappear and they improve. With acne scarring, again, I would say this is for an experienced hand. Understand what you are treating. With acne scarring, where you want to flatten the skin around the actual scar, you treat actually the area around the scar to improve the appearance of the scar. You're not treating the scar itself. So be very careful. If you have rolling scars, acne scars, then yes, you'll get a good result because you're just kind of leveling the level of the scar. But if you're treating a pitted scar, you understand that pitted scar goes deep into the dermis. You're not going to remove that scar. And don't treat the actual scar itself, the embedded bit. So again, assess the skin, decide what is your device going to do based on its capability as opposed to just plexering away. So here she's working on the outer edge of the scar to actually give you a little bit of flattening. And then some results, which is quite impressive. You can see that you are treating the raised, healthy skin around the scars like you would do with ablative CO2. And also with atrophic scars, this is again very beautiful results that you can achieve with atrophic scars as well. And then elastosis. I think that's, again, if you understand the biostimulatory impact of Plexr on the dermis, where you are improving the architecture of the papillary, the connective tissue, where with elastosis we see the breakdown of collagen and the disorganization of elastin that gives you that leathery-like appearance. You're going to biostimulate that area with the heat that is transferred into the dermis, and it's going to improve the quality of the skin. Preauricular wrinkles, a pain for women and men, and beautiful results. Also elastosis. Neck treatments, be careful of the neck. If you like treating necks, the neck can be a dragon when it comes to healing. It's much more dehydrated than the rest of the skin. It's much more prone to inflammation, so be very, very gentle in your approach. I generally do a test spot to see how the skin would respond and how the patient will handle the skin when it's healing, so that I can forecast a good result. Removal of skin lesions. You're using your Plexr as a scalpel almost, so you're spraying the lesion off. And essentially we are using the spray technique. Again, if you're using soft, tiny lesions around the eye, use your white Plexr or your 0.7 watt output. If you're using the Plexr Pro, you would use your Plexr Pro 1. And for your more ruddy lesions like your seborrheic keratoses or your sebaceous hyperplasias or your fibroadenomas, I think, again, if you're not a dermatologist, make sure that it's not a cancerous treatment. Be very careful of basal cell carcinoma. I'm not sure how common it is in Italy. We have a lot of patients with basal cell carcinoma. You only have one chance to treat a basal cell carcinoma, and that is to actually do a biopsy. So always make sure that you're treating a benign lesion. And basically, you're spraying and wiping and spraying and wiping until that lesion is gone. Understand that lesions that are generally dermal in origin will always come back. So explain to the patient that the lesion might come back in time, but again, you're not going to cut it out, so there's no scar for the patient. It improves beautifully, heals beautifully. Patient with mine, papulosa nigra or dermatosis DPNs, very nice aesthetic improvement and how it just makes the face look a little bit more fresh, especially for men. Big growths, again, make sure that they're not cancerous. Seborrheic keratoses, lesions on the lips, lesions inside the lips, and then also herpes labialis, so your herpes simplex virus, it somehow has an antiviral effect. So the moment the lesion starts appearing, I actually plexer the area and actually works quite well. And then warts, any type of wart. Always make sure knowing what you're treating is important. So in angiomas, always understand that there might be something, a bigger problem around the eye. If you're ophthalmologist, then you're safe. And then solar lenticos, again, we are removing genetically damaged tissue. So yes, you're going to remove the pigment, but that tissue is genetically damaged. It needs ongoing sun protection to keep it at bay. It will eventually come back again because that is damaged DNA that has a message to make more pigment. So it's not permanent, but you are treating the defect. Also improvement in solar lenticos. On the hands, quite a nice treatment if you like to treat that. You can imagine a full face rejuvenation. Again, you have the ability to treat one area per area per area as you go, and that's depending on your patient's needs. But that patient will come back to you for further treatments of further areas. Last, just another added novelty to the Plexr is a different connector. Here we're using not so much the plasma energy that's going to create an erosion in the skin, but we're almost creating a chemical or plasma peeling effect. So by stimulating the area with the energy that's discharged from the device, you can create almost a electroporation, so that when you apply an active ingredient, you're able to actually infuse that via vehicalization, get that product deeper into the epidermis. So you would insert your smaller tip, your green tip, to create your plasma peeling. When we do the practice, I'll show you how to do it if we've got a bio tip. Here you don't want to create a spark. You want to just touch the skin the whole time. Then you apply your active serum. Here we use a hyaluronic acid serum to then drive into the tissue. And then you would repeat the treatment over time. First weekly, then 2 weekly, then monthly. And these are the results that you can achieve. So what you're doing here is you're actually optimizing the skin barrier of the patient before or after you've done your Plexr. Quick little video. How am I doing for time? Good? Okay. Almost there. So a quick plasma peeling. Clean the face. That's a little Plexr tip. As you can see here, we are not doing a Plexr treatment. We are just creating a bit of a peeling effect. And you can actually smell the removal of the extra keratinocytes. You're applying your active ingredient of choice. hydration, hyaluronic acid of good choice, and then you're driving that into the skin. So it's an additional treatment that you can offer your patients. And then your home care.